You're still watching TVC Breakfast. We now talk about this very, very important conversation. Now, the Lagos State government has announced a statewide Measles-Rubella MR vaccination campaign scheduled to begin on the 27th of January 2026 and end on the 5th of February 2026. Now, the 10-day initiative is aimed at reaching about 10.5 million children between the age of 9 months and 14 years to reduce the burden of vaccine-preventable diseases in the state. Now, according to medical officials, investigations have shown that when children are tested for measles, many are often found to be co-infected with rubella or affected by rubella alone. Now, the overlap makes the combined measles-rubella vaccine a critical public health intervention. Joining us in the studio for this very important conversation is Coordinator, Lagos State Immunization Program, Dr. Akimpelu Adetola. We also have Medical Director, CEO, Ijebu-Lekki General Hospital, who is also the 25th President, Medical Women Association of Nigeria, Lagos, Dr. Ime Okon. Good morning to the beautiful lady and gentleman. How are you doing this morning?
Good morning.
Good morning. Nice to have you.
Ibejuleki, not Ijebu.
Yeah, Ibejuleki. Nice to have you on the show this morning. But let me start with you quickly. We're talking about this very, beautiful initiative. But people will then wonder, before we came on, I was speaking about a lot of people are very skeptical about taking, vaccines because of, a narrative that has been spread. But we know how measles is very dangerous in children. We know that it kills. We talk about rubella as well. How effective do you think that this campaign, is going to go, knowing that it's working for 10 days? How effective do you think that it's going to work? I'll start with you.
All right, thank you very much. So it's a 10-day campaign, and we have a huge number of persons to vaccinate. Yeah. Now, one of the things that we've done as a state is this. We didn't just start planning today. These plans have been in place for months. We've taken stock of when we have these persons. We've taken stock of what we need to ensure that within this duration, we are able to reach them. So it means that we have a pool of almost 5,000 trained healthcare workers who will be deployed across the states to reach every single community. Now we're talking of even the riverine areas, those places that you need to access through with the boats, those places that you need special transportation to get to. They've all been mapped out. And not just mapping out, we've gone ahead to actually have conversations with these communities, to engage them, to let them know that within this duration of time, we would be sending vaccinators.
How responsive are they, actually, to the information you sent?
We do know that one of the things that has been constant is that vaccination in Lagos State and Nigeria as a whole has gotten a very huge positive traction. Yes, there will be pockets of naysayers. Yeah. There will be pockets of people who would have one reason or the other to doubt the efficacy. But we would continue to engage. And we need to also understand that it's not just a 10-day and it ends there. Yeah. Our goal is to ensure that everybody is reached. So we'll continue to engage them, we'll continue to talk to them, we'll continue to show them with evidence that vaccines work, till we can get them to convince them to make that informed choice to accept the vaccines.
Yeah. All right, Dr. Cohen, after what's it called again, the coronavirus, some vaccines came. And we saw all sorts of magic during that period where after vaccination you put a coin in that area and the coin sticks and so on and so forth. And people started losing a lot of confidence in vaccines. There were very fantastic stories that were making the rounds at that time, concerning the efficacy of vaccines. So my question is a little bit, maybe it would have been directed at you because you deal with the public. You are a private medical practitioner, I believe.
Public.
Oh, you're a public medical
General
practitioner.
hospital.
So it's good I'm asking you this. In engaging the people, did we talk about what these ailments are? Rubella, for example. Did we tell them how dangerous it is? Did we tell them what measles can do to people? And it will tell them that this vaccination will stop all these things from happening? Did we do that?
Yes.
And what was the reception like?
Okay, so thank you very much for having me this morning, and thank you for your question. So in having engagements with people, this, especially on this MR campaign, we need to let them know what is measles, what is rubella, and what are the symptoms that you see that make you know that these diseases are what we are observing. And we also tell them like the statistics once in a while, because like for measles, we are like the second globally. Wow. After DRC Congo. In Nigeria is the second when it comes to the number of cases of measles worldwide. So we need to tackle it, and these are diseases that have lifelong effects. A child can be blind, a child can be affected in the central nervous system, and the congenital rubella syndrome that we're talking about can make a child to be deaf, have a congenital heart disease that most times you say hole in the heart and things like that. So these are the things that we mention when we're talking to them, and we try to go through people that they respect. The traditional leaders, the religious leaders. You know, there are some people that anything my GO says is what I'm going to do. So we try to go through these people. We talk to them, the people they respect. We call them gatekeepers, the influencers, people that they listen to, people that they respect. We all know that as long as something is not part of your body, you may have a side effect or your body may react to it. So it's the same thing with vaccines. But then let us look at the risk and the benefits. If the risk is like 1% and the benefit is like 99%, why not go for it? And even while we're doing this, I'm sure we've seen even in this MR campaign, people like Kate Henshaw has come out to come and say something about the MR campaign, supporting the vaccination, showing her own scar, how she wanted to hide her own vaccination scar too, but she's better off for it today because she's alive, well, and active. So what do we gain from preventing our children from having the vaccination that can lead to death? And if it doesn't lead to death, can make them to be alive but not well and be able to expatiate or display their full potentials because of the complications arising from these illnesses. So these are the messages that we're passing on to them.
Yeah, but let me come to you now. I'm not well convinced because we're saying 10.5 million people, children will be vaccinated, and we're looking at 10 days. I need you to speak to me about the rural areas because you said something about that, but I need to understand how is it going to get to this kids in the rural area? Because I tell you what, according to Nigeria's Center of Disease Control, about 153 children died from measles in 2025. And, we're looking at 19,000 cases that were reported. And some of these cases, these are facts, some of these cases are majorly in the rural area. So with this whole campaign, how are you able to get to the places where people would not normally get to?
One of the things that we do in vaccines is that we reach where even people think we cannot reach. Before we started the whole planning, we did what we call a micro plan. This is where we break down the states from local governments into LCDs, into wards, into catchment areas. So we've done this. What we also do is we do a population, kind of a population assessment. So we know that in this community, we have, say, 100 children. In this community, you have 150 children. We've done all that mapping. So that tells us to deploy. For a community that has 100 children, you need to deploy this number of vaccinators to reach them within this certain period of days. Yeah. For you to reach this community, and this has been done. So we have that map. We've reached the community, and we didn't develop these maps by just healthcare workers. We worked with community members. Okay. They know their community. They know who and where these people are, and they've given us all this information. And we've mapped all this, and this is what we took back to develop a strategy on how to reach everybody. So we know on this day, this community, they have markets. You don't go there. You wait for maybe Sunday, and you go and reach them. There are communities where we plan to reach them in the evenings, because that's when the caregivers would be at home. Okay. So these strategies have been there. Like I said, we've been planning this for months.
But do you think 10 days is enough?
For us to reach that number, well, with the teams on ground, we would be able to reach it. But then we also know that there's a possibility that you will get refusals, you will get rejections, and you will need to go back severally. You will need to go back and re-engage and have that discussion with them. So we have what we call mop-up days.
Yeah.
We plan to also continue to mop up. So we have the resources, we have the vaccines. We are not saying after 10 days we're going to pack the vaccines and take it back. No. It's
But
still there.
Are you going to start with anything like education? And I'm saying this because I know people that will tell you I would not allow anybody, put anything in I would not allow anybody put anything in my child, because we've seen some children that have taken vaccines and we've also seen what happens to them. I'm not saying that I had measles when I was a kid, so I understand the importance, of making sure that the vaccine is taken. But how are you now going to do that mass education to these mothers in the rural areas that do not even understand what you're talking about, but you're telling them that you want to vaccinate their children?
We have been engaging on different levels. So we have health educators across the states. And they have been going to every community. And it's not just limited to these health educators. We have health centers everywhere. We have healthcare workers. We have community health officers. They've been engaging people within the communities, talking to these women, talking to the market women, talking to the associations, the bus drivers, everybody, just to ensure that we pass this information. We've engaged the educational sector. We literally are engaging teachers so that they too can, when they interact with the parents, when they interact with the students, they can pass this information to them. So what we're doing is not just saying, it's not a health sector thing. It's a collaboration. The health sector, the educational sector, transport, every other association. So we're interacting and collaborating with everybody just to ensure that we can push this information as far and as wide as possible.
If I may add, if I may add, while we're preparing to have this campaign, everything is going on simultaneously. As we're training the people that are going to go on the field, we're having what we call social mobilization at every level. And that includes what she's saying, going to schools, talking to the religious people, people that can take it down to the grassroots. Like we always say, it is a bottom-up approach. It's not a top-bottom approach that we're using for this. And also making sure that we have enough commodities. So it's not enough for us to say, come and take the vaccine, and you get there and they say it's finished. So everything is going on simultaneously, just to ensure that it goes well. We can't just barge into your house and just say, take, this is what you need to have been pre-informed. So we're trying to do this as much as possible.
Yes, and some people are just adverse to anything that they do not know, they do not understand. And that's why it is very necessary that the education hits the mark. So how have you leveraged technology to get this thing done? If we put in some adverts on social media that speaks the language of the people, that talks to them the way they understand, I think it will crack some of this. And we're looking at 5,000 vaccinators thereabout, and our target is 10.5. That makes it about averagely 200 per vaccinator. Isn't that heavy?
Who's going?
So,
it sounds like what he will answer.
Yes, I definitely will answer it. So we do what we call a workload rationalization. And we know for each team, they have 2 vaccinators. So we have almost 5,000 teams. So it means that we have 2 people that can administer this vaccine per team. So it means that in total, we have about 10,000 persons that can administer this vaccine. So we've done a workload rationalization. We know that in a day, from the time it takes them to move from the take-off points to when they get to the various places that have been mapped, because we have what we call a daily implementation plan. And this is a plan that shows within the 6 hours where these vaccines need to be out there, you can reach X number of schools, you can reach this number of churches, you can go to this number of communities. And like I said, we do this mapping with the population estimates. So we've mapped, we've deployed according to how they can cover. We know that for people going to riverine areas now, it's a day's journey. So you're going there just to cover the people there, and that's all you can do. So if it's just 30 children that are there, that is what you're going to do for that day. So we've done this rationalization, and this is as informed on how the teams would be deployed, and that's how we are deploying them.
Okay, but
sorry,
okay.
Ria, that's just one part of my question. The other part is, how have you, leveraged technology to get this information to people? I'm telling you, there are people out there that have 6, 7 children, some of them 15 children, and they vow that, look, no vaccine will get into any of my child because I don't know what's going on. And in most cases, it's because we didn't speak their language to them. So they don't really understand why they need that vaccine. In fact, there are people maybe around them that they see as educated and so on that will say, if you do that vaccine, your pikin don't die. We have cases like that. So how have we leveraged technology to get this message across to them?
At this point, we're in a social media age, and which is why we also have the social media influencers as part of our teams. As you can see, if we look at the followership of some persons like, say, Kate Enshaw, of people like a noisy pediatrician, these are people that have good followership, and these are people that have been part of this planning right from the start. So we're leveraging on their platforms, we're leveraging on state-owned platforms to still continue to push this information, because there is no limit. You can't really determine what platform one person would listen to. At the rural areas, they would want to probably follow their local radio stations. They follow press people that are talking to them through the local government. So we're also working with these stations to ensure that this information is getting out there. And we're also ensuring that the right information is what we are putting out there. So we're working on several levels. And we're not just doing it in English. We have information, we have in English, we have in Yoruba, Egun, because we know Lagos is a melting point. We have in Hausa, Igbo, every language that you can think of, PG. So we're pushing the information, we're running jingles, we're running...
That was personal.
You go here, no pay.
So yes, we're putting it in diverse languages so that we can reach as many as possible.
The teams we are forming is a 6-man team. Apart from vaccinators, we have people that are recording, then we have crowd controllers and the people that are mobilizing. So in this team, when they enter the community, you will see maybe your Sunday school teacher as part of the team. You should be able to trust your Sunday school teacher. You will see you see one of your market leaders as part of the team that is calling you out to bring your children. You should be able to trust those people. So for every team, we make sure that there is a person, 1 or 2 or more, that is a member, an integral member of that community, that just seeing the person alone will make the person to know that I should be able to trust this team. This person is not going to go after the campaign, is going to still be with us. So if anything happened to my pikin, that you are go hold.
Local content, very correct.
But there's this comparison on social media, and this question is from one of our audience. We talk about measles and rubella. So we talk about measles being very serious in children, and then the rubella mild in children. They say measles can kill, rubella rarely kills, and then the measles spreads very fast, and then the rubella spreads slower. And then the measles dangerous to kids, and then the rubella dangerous to unborn babies. So this is what was put here. But my question from the audience is saying that the two, this is 2 that is going to get into the child, and we're looking at 9 months. They're saying, is it not too strong for a 9-month-old child?
One of the best times to vaccinate a child, and this comes not because people just thought, let's bombard babies. We have advisory committees, independent advisory committees that look at vaccines before you introduce to a country. It's called the National Immunization Technical Advisory Group. And every country has this committee. They are made up of diverse professors, scientists. They look at the benefits. They look at the vaccines. They weigh the options. What's the cost option for this vaccine? Because one thing is introducing a vaccine, another thing is sustaining it. So is it sustainable? What are the benefits of this vaccine? What age would be the best time to administer this vaccine? And this has been what has guided every vaccine that you take. You remember when a child is 6 months, we give what we call the pentavalent vaccine. That's 5 combinations in one. Now, in some countries, it has gone to 9 combination in one because they've realized that you can, at one shot, cover as many as possible.
Okay.
It's safer, it's more efficient. So, and that's the theory that we're applying for introducing this, rather than just doing standalone measles. We can use the opportunity to also protect against rubella.
Yeah.
So why not?
Why not? Well, which makes sense. But in terms of financing, you know, what's the budget like for this particular campaign?
RIA is huge.
We want to know in terms of financing, you know, how are you guys working with financing? How is it like? You know, how has it been like? Because we know that Lagos State is largely involved in the campaign as well.
Yes, and with all thanks to Mr. Governor, who has also committed financially and also committed personally to ensuring that this vaccination campaign, not just at this campaign level, but at the point when it becomes routine immunization, is successful. Vaccines are deployed with funding from different levels.
Yeah.
We have funding from the global partners, we have funding from the federal government, we also have funding from the state government and the local governments. So it's all this mapping is what comes together. You bring it together and it gives you a plan of what you're going to do. So as you're planning for a campaign, you're also doing the financial mapping, and all these have been put together. And I can say that the government has been 100%
And I hope the money is at the
supportive.
right hands, because oftentimes, you know, monies are given for some things that are diverted to another. No, we are having honest conversations here. You know, I hope the monies are also the right hands, the people that are handling it.
Yes, definitely.
Okay. All right.
Okay, Dr. Ime Okon, right?
Yes.
Okay. When is this starting?
27th, actually.
27th.
Tuesday.
Yeah, Tuesday, 27th
Next
of
week.
January. Yeah.
Next week, Tuesday. You see, when we call dates, I always like the dates to be followed by the day, you know, so people don't get confused.
Tuesday, 27th
27th.
of
Are
January.
we going to have a situation where members of the community are made to stay at home because of this? Are we going to have any kind of public disruption because of this immunization exercise?
Not at all. We're not. We're going to meet them in the community as they are doing their businesses. We're getting into. Okay, so for instance, Tuesday is a school day, so we're going to have teams go to schools. So children are going to be brought in batches. It doesn't disrupt there's not going to be a public holiday because of that. So it's music while you work.
So we know more because we have 9 months to 14 years are the you know, people you're primarily looking at.
The school ages there too.
Yeah, so we have mothers bringing their kids for it as well. I feel like it's a fantastic initiative. I just hope that, you know, we do not stop at just 10 days. That's my fear, because I'm looking at 10 days not being enough. But you are assuring me that you can get to 10.5 million people in 10 days. I don't know how you're going to do it, but you've said it on national TV, so I'm sure that you're going to do it. But I'm just hoping that we extend the conversation beyond these 10 days.
One thing we can be rest assured, the resources are there.
Okay.
And we would continue to deploy. Because what we also do on a day-to-day basis is to review the data. What have we done day 1? What have we done day 2? We keep prorating, we keep discussing. So by day 8, day 9, we know this is what we've done. If for any reason we see that we've not met that mark, then we would extend, because this is a decision we would make as a state with our partners and say we need to do more. So the government is involved. Whatever resources that we need will be deployed to ensure that we reach these targets.
Okay.
If I may add, sorry,
all right.
we have review meetings every day during campaigns at the local government level, at the state level. So when we come back from the field, we have a meeting and we assess what we've been able to achieve that day. And it's vis-a-vis the targets that we have. So from day 1, we have a cumulative target that tells us, are we getting to what we planned to? So from day 1, we start knowing, day 1, are we 10%? Are we 15%? By day 2, are we 20? Are we 25? Like that cumulatively. So that helps us to be able to plan ahead and know what is ahead of us. If we're going to round up on day 10, or if we need to shift it to 11, 12.
I strongly believe it will be shifted, looking at the amount of kids that you want to reach. But yes, we'll keep our fingers crossed, and I'm sure we'll definitely have you on the show again, you know, just to tell us the updates and how well that you have done. I wish you all the very best with this campaign.
Thank you so much.
May God protect you. May the monies be put in the right hands.
Amen.
May every child get the immunization. Thank you so much. All right.
Thank you.
Thank you so much.
All right.